Hello, I'm Dr. Maria Sulindro, specializing in integrative anti-aging medicine, practicing in Pasadena, California. I hope the weather is nice to you today. And today I'm going to share with you something that is not major in medical, but is still 1% of the American populations. But I believe also that this is because community is not aware that it is something you can do and to avoid dementia. So this is called idiopathic, meaning that no cause or whatsoever, and NPH is normal pressure hydrocephalus. So the pressure is not up, it's normal, but the brain, part of the brain, this is called ventricles, is enlarged due to the abnormal flow of the cerebrospinal fluid. Okay, now, before I start, I would like to thank you for subscribing to my YouTube channel and like it and also share it. And we are also on Instagram and Facebook. And the address is the same for the Facebook. Instagram, you can go to Ask Dr. Maria. Thank you. I'd like to share with you my slides so we can slowly go down the, slides by slides, and you can follow me easier. One moment. Let me share this one with you and share screen. Yeah. Okay. You can see the first slide. I explained about a small percentage of patients with dementia may have a brain condition called the NPH, which is normal pressure hydrocephalus. The good news here is that with the appropriate intervention, the dementia can be reversible. What people, as we age, we would like to know if dementia is reversible, right? So this is one of them. This is why we have to bring this awareness in our community. Hydrocephalus can also happen with the newborn baby because it's an abnormal brain. And for children who has hydrocephalus or baby, if it is not treated, the survival is very low. 50% of affected patients will die before age 3, and approximately 80% die before reaching adulthood. Treatment markedly improves the outcome for hydrocephalus, not associated with tumor. This can happen also with tumor. And some of them were reported to 89% and 95% survival in 2 case studies back in October 2020. Normal pressure hydrocephalus that has no apparent medical cause called INPH or idiopathic NPH. This is totally different from the secondary one, which has a cause by diseases or sometimes injury that interfere with the cerebrospinal fluids, which is the liquid that keeps our brain bouncy enough, okay? And when the absorption is different, so it can create a problem with the flow. And this may be associated moderately with elevation of the CSF or cerebrospinal fluid pressure, despite when you check, it is normal pressure, which is the name NPH. The newborn that has hydrocephalus, it is congenital. Some cases are because of tumor blockage in the region of the fourth ventricle, like the one in the picture here. There is a tumor, and also medulloblastoma, which is very often found, but not very many. All the cases are not high percentage. Okay, let me get my, what is that called? Let me see, previous and show. I would like to have my pointer. Laser pointer. Okay, so I will use this pointer. This is a picture of a baby that was born with hydrocephalus, and you can see the feature is different, and this need intervention. If not, the baby will not last too long, or 3 years of the average age. For the adult, which is the INPH, potentially reversible neurodegenerative disease, because this caused neurodegenerative disease. And this is commonly characterized by what we call a triad. It is 3 symptoms. 1, dementia. Everyone knows what dementia is a memory impairment, so forgetfulness. It can be mild, it can be fast, it's called moderate or severe. Now the severe one, sometimes you call them Alzheimer's. Okay, that's one of the differential diagnoses. Make sure this is not Alzheimer's. So the second symptoms is the gait. You don't walk normal. Sometimes you fall down with no reason and you do not know why. So you are off balance. The balance is affected by the accumulation of the fluid in the brain. So it affects the motoric function. And the third one is urinary disturbance. So this is because it's affected by the flow that is not normal either. So early diagnosis is advancement in treatment. That's the reason why I think everyone should know about these 3 and not thinking that, oh, it is just aging. I'm old already, so I deserve forgetfulness. I'm old already, so I cannot walk straight and I fall. It's because I'm old. No, that is not supposed to happen, okay? Now let me explain to you what we are dealing with. The blue color here is the ventricle. This is the frontal horn, and this is the occipital horn at the back, and this is the temporal horn. Now, where is the ventricle? This is called the lateral ventricle. This is called the third ventricle, and this is called the fourth ventricle. Now, this is called the aqueduct. So the ductus that connects the third and the fourth is called aqueduct. Now, we just have to remember that cerebrospinal fluid is created by what we call this. Okay, just a second. I will show you the picture. Just one moment. Okay, the majority of the case of NPH are idiopathic, meaning we do not know the cause. But in some cases, like we said, it can happen when you have head injury, cranial injury, or cranial surgery, subarachnoid hemorrhage, meningitis. This is the infection in the cover of the brain, tumor or cyst, as well as subdural hematoma, bleeding during surgery, and other infection. And all of these has to be appropriately addressed so that the treatment is very specific. Now, okay, choroid plexus. So if you see this line here, okay, this one is called choroidal plexus. This is where we get the CSF, cerebrospinal fluids, the water that will be circulated all along the side of the brain and down to the spinal cord, and then it goes back again to the brain. Okay, so these are the ventricle of the brain. When you cross section it and look from the top of the head. So the choroidal plexus is secretory tissue found in each of the brain's ventricles. So both ventricles has it. The main function is to produce the CSF. Brain model, okay, this is the white matter, okay, this is the ventricle in the middle, and this is the choroidal plexus here, okay, and this is the gray matter. So we have white matter and the gray matter, just like the color. From the side, it looks like this. Beautiful, isn't it? And this is the fourth ventricle, the third ventricle, the lateral ventricles. And there are two, one on the right, the other one is on the left. And the blue color is the brain. Other diagnosis of cognitive impairment or a memory impairment is Alzheimer's and small vessel ischemic disease, such as stroke that caused that one, okay, or all the people who usually smoke, all the small vessels usually is clogged, and this can cause memory problem. Now this is another view, but this is a cartoon view, okay. This is the, I think we saw this one already, right? This is the lateral ventricle, this is the third ventricle, and this is the fourth ventricle. We concentrate on in that because that is how we diagnose it later. The accurate diagnosis of the INPH is very important because the CSF diversion is not without risk, and it yields varying results in this particular patient cohort, meaning that it is not difficult, but it's not easy to diagnose it for the treatment. The CSF tap test, that is one of the diagnoses, is to do a spinal tap, and that is the test, consisting of quantitative measurements of gait and cognitive dysfunction before and after the drainage of the approximately 40 to 50 cc of lumbar CSF. So it has been shown to predict the outcome of the shunt surgery, which is the procedure that can save these patients from the dementia and also from falling down a lot. And this degree of clinical improvement, though it has a low sensitivity, is done. Now, this is the flow of the CSF through the ventricle. So remember, this is the ventricle, okay? And so the CFS is made by the choroidal plexus, and then CSF means the fluid, okay? And then so it flows like this, and it goes all the way, and some of them goes in here. This is the cerebellum, the small brain, and it goes through this area, okay? From here, it goes through here and go up all the way, and then this is, we need to have this. You cannot have no CSF, right? Because when you have any injury or you bang your head to the wall, and so the brain can actually bounce back and forth without being smashed. Okay, now, and this goes down, all the way down to the spinal cord, all the way down, and then it goes up again. Okay, now this is the flow of the CSF. How do we diagnose the normal pressure hydrocephalus? Like I said, it's not difficult, but it is not easy either to diagnose it. Yeah, this decision, because they are mild enough symptoms of what the patient has. And some patients do not even think it's necessary because they think it's an old age. So for those of you, I don't know what do you mean by old, okay? But this can happen at the age of 60 and above. And many people fall down from between 60 to 70. It can happen because of the idiopathic normal pressure hydrocephalus. I'm going to say NPH from now on, okay? I'll tell you a little bit about personal history. My father, when he was 70, he likes to jog outside the house on the street. He jogged about maybe like an hour in the morning. And so he noticed that he is not balanced. So I also noticed that when he walked, he had to be very careful. And sometimes I picked up the shuffling steps. So I took him to see my friend who was a neurologist, very smart neurologist. He's no longer here. And my friend quickly said, oh, let's just take a window CAT scan. You can have a CAT scan or you can have an MRI. And he showed me very clear that he had one ventricle bigger than the other. So he said, your father has normal pressure hydrocephalus. You should go to a neurosurgeon to have a shunt placed so that to have further diagnosis. So we went and the neurosurgeon did a test and the test was negative, meaning that they usually do, they drain a little bit of the spinal fluid and then they will see if your gait and walking improved. So at that time, he did not have dementia. Okay. Now, um, then at the age of 80, he fell a couple times. It was like maybe in 1 month, he fell 5 times. So I remember the diagnosis. So we repeat his MRI. This time is MRI. And very clear he had NPH. So I took him back to see a neurosurgeon and did a spinal tap again. And it was not significantly positive. So because he was already 80, and the neurosurgeon said, well, so we asked about the risk and also what is the side effects and everything. It was, I should have done it when he was 70 actually, even though the test was negative because he fell many times after that. But the neurosurgeon decided not to have it done. And so we know he had this NPH. What happened at the age of 84, he had a stroke, little stroke, okay? And he still did not have the dementia then. And then at the age of 80, and then when the first stroke, he recovered, in fact, 100% or 110%. And then after age 87, I think 86 or 87, he had another stroke. So, but even though it's a small stroke, but it has affected his brain. And so his memory declined. So for people who they think that they are not the same, I want you to make sure that you go see a neurologist or see your physician and have it done. And have it done means diagnose it. And when they diagnosed it, the procedure is not very difficult. Okay, let's go through this. This on the left side here is the CFS flow. Like I said just now, there was a picture of how the CFS flow, it goes down, okay, it goes down here and it goes back up again. And then it just go like that every day. This is every day, very delicate, but you don't realize how amazing the system in our body is, okay? And then this is the test. It's called lumbar puncture test. You can have it prone, I mean, on the side position, lying down position like this, or you can have it sitting up position. And then they will measure it. There is a nanometer there, and then you can measure the pressure. And then it is very important to measure the pressure so you can drain the 50 ml without affecting too much pressure so that the patient doesn't faint, okay, or have a headache. Now, this is the MRI. This is normal ventricle. And then when you take it and one NPH is, you can see how big the ventricle is in this patient. Now, this size can push the brain to the side and also pushed some of the delicate things in here and affecting the brain function and motoric function. Now you can understand what it means by hydrocephalus. So the liquid actually accumulate here. What is the treatment? No medication. This is unfortunately, you cannot medicate these situations. So the treatment is a procedure called ventriculoperitoneal shunt. They actually place a shunt in there. The shunt is to drive the volume that is excess and causing pressure and symptoms to get worse. And it the procedure drain it to the abdominal area. So this is the ventriculoperitoneal shunt, okay? And they place the shunt in the ventricle. This is the enlarged ventricle. So they actually puncture the head, the scalp, okay? And then put the shunt in there. And then they usually put like an opening behind your ear. And it's not very big. It's an opening it's a valve to monitor or to adjust the pressure or how much you want to drain. And then so it will go down and it will go to your abdominal and it will drain there. Patient symptoms and complication. I thought this one will be helpful for talking about percentage. Symptoms before the treatment, 100% had gait changes. Usually the gait changed. 81% had urinary incontinence. 71% had cognitive impairment. So you can tell here that all these symptoms, people easily can say, oh, we are aging. That's very common. And then they don't do anything. So this is what I think it's very important for community awareness about this NPH, even though it only affects 1% of the population. But if the 1% here is among 300 million populations, so it's about 3 million people are having this problem that has been diagnosed. What about those who do not even know and never go to see a neurologist, right? So the improvement in symptoms after the ventriculoperitoneal shunt, 74% had gait improvement. That's a lot. 44% had urinary incontinence improvements. 45% had cognitive improvement, which is very good already, right? So complication after the treatment, only 29% reported headaches, and which you can adjust the valve, maybe it's too much draining, and 10% had subdural hygroma. What's hygroma? Okay, I put down here. Hygroma is a cyst or a group of cysts found mostly in the neck, a cyst in the neck. They are caused by an error in the development of lymph sacs and lymph vessel as the baby develops during pregnancy. This is for people who already have hygroma when they were born. By the end of the 5th weeks of pregnancy, the baby's lymphatic tissues form as a lymph sac. So that's when it goes into abnormality. But from the shunt, you can also develop a cyst. Now, actually, I was trying to see if I can play this one, but I don't think it's necessary because this is to show you the test. It's very simple. They puncture your lumbar area with a big spinal tap needle, and then it's very not very painful at all. In fact, this one they numb the area and then they puncture with the spinal needle. And then when the spinal fluid come out and they measure it. How safe is the procedure and the treatment, and what are the risks? Well, the risk is the anesthesia if you're allergic to it, and then you have a comorbid problem in the previously, okay? Like for example, if you had undetected, low blood pressure or high blood pressure or whatever, or there is an infection, bladder infection. And it can cause other infection, but if it's done with a sterile situation, it will not. And then blood clot, if you have any blood dyscrasia, meaning that you have blood problems, which can become a comorbid. Otherwise, the shunt infection, if the hygiene is poor, the risk is perhaps 5 to 8%. I did ask this to the neurosurgeon. He said, yeah, maybe 5 out of 100 patients will come, and then they will see that the shunt is clogged or infected, and they have to redo it. The actual surgical procedure to implement a shunt typically requires about an hour in the operating room. Afterwards, you will be carefully observed for 24 hours, and you stay in the hospital will be generally for 2 to 4 days. That is the most if you have complication, but otherwise you go home the next day. Some people with NPH experience what is that? Yeah, let me see. This one is blocked by my own picture here. Hang on a second. Anyway, the experience a gait that is abnormal, often when tired or stressed, then it is more obvious. This is, see again, when you are aging, you think that, oh, you're tired and you're stressed, so my gait is abnormal. But just be careful and remember, when there is an abnormal gait, can be from the brain. If you experience this all the time, go to your physician, as your shunt may need adjustment if you already have shunt. When after you are being shunted, okay, if you have shunt and then you have this problem, you need an adjustment. This is probably the slides that I prepared was for that. Now, this is, you can see, this is the valve. The valve usually is here, okay? And they put a shunt in here, and this is the shunt. They put it inside actually, and then it goes to peritoneal, which is to the stomach, and then you urinate it. What happens if it is not treated? Okay, let's say you don't want it because it sounds scary. They go through the scalp, which is quite safe. This one, neurosurgeon done like hundreds or in their practice life. Well, the symptoms usually get worse over time if you don't do it. Patient with untreated advance in NPH may experience seizure because the brain is pushed, which can get progressively worse. And then about the dementia and or bladder control problems usually appear after the gait disturbances, as the condition also will progress. Okay, hydrocephalus can also affect the eyes for acuity, coordination, judgment, and concentration. All of the skills which are necessarily to drive. So it is very dangerous if you have NPH and you don't even know, because your vision can be affected and coordination too. Just learning how to coordinate between controlling the steering wheel and applying the accelerator or brake can be a challenging when you have poor motor skill. So this is the point here. Hydrocephalus can permanently damage the brain. Yes, if it's too long, compress the brain, yeah, it will damage the brain, causing problem with physical and mental development. That is for sure, especially when you were born with this. If untreated, it is usually fatal in children, and with treatment, many people lead to normal life with few limitation only. With an adult, it is a prevention and reversal of the most important thing here, which is dementia. You don't want to live long life and you are demented, right? I mean, you cannot remember anything is the worst. So this is another picture, corpus callosum, which is a big circle here or a half circle. And this is the lateral ventricle. And this is the fornix, and this is the aqueduct, and this is the fourth ventricle. So usually the lateral ventricle, this one is the one that you've seen in MRI enlarged. What is the outcome? Unlike most surgical procedures, actually, in which the risks are highest during the operation itself, but most of the common problem associated with this shunt can and occurs later time, because you have to be very clean, and you have to take care of the area, and wash your scalp when it's necessary. And the most common complication with shunting are obstruction. They can push, okay? And then the infection, they have to treat. And over drainage of the cerebrospinal fluids make you feel headache. Overview. Many people with normal pressure hydrocephalus enjoy a normal life with the help of the shunt. Regular ongoing checkup with the neurosurgeon will help ensure that your shunt is working correctly. They will ask you to go back every 6 months. Your progress is on track, and you are free to keep living the way you want. Then you might not even feel it because it's all under the skin. Okay, take home message. Always check with your own memory and gait. Always. I mean, if you feel differently, don't be shy. Don't be shy. Just tell the doctor, I think I don't have the same memory, or I think I don't walk quite the same. Always tell. And tell your physician that you feel differently with your ability to remember and need a test. Then we'll send you for a test. Follow the test and recommendation, and make decision early before the brain is damaged or before it's too late. So this is the picture of the lateral ventricle, the third ventricle in the middle, and the fourth ventricle. All of these can be affected. Thank you for listening, and please subscribe, like, and share. And these are all the address that I have. Let me see if there is questions. There's no extra questions. YouTube address is Dr. Maria Aesthetic and Anti-Aging, the same as the Facebook. Instagram is Ask Dr. Maria. So every Thursday I bring this live, and on Friday we have the Indonesian language with usually I invite guest speaker, a physician who fluently speak Indonesian and also live in Indonesia for a better understanding. Okay, so let me stop sharing first, and let me see how to stop sharing here. Thing is here. I don't know how to stop sharing here. This is difficult. Not quite sure how to do this. Okay, let me see. Shift. Okay, stop sharing. How to stop sharing? Okay, I'm going to see if I can stop share here. How to stop end the meeting? Okay, thank you so much. And this is Dr. Maria Sulindro. And